You know, those two things, high blood pressure, the pressure, as Black folks call it, the sugar, is, if you're talking about diabetes, whatever terminology you want to put on Black folks, hypertension and diabetes are closely associated with kidney disease. One, talk about why that is, and help with people understand why that is. And then also on the other side of that, why that impacts Black people in a very significant way.
So in terms of the comment about kidneys are sensitive, I actually would say that the kidneys are very, they really suffer in silence. Like,
Okay.
and that's kind of one of I mean, it's like a double-edged sword. You want people to feel good, but at the same time, when most of us feel good, we don't seek care, or we don't act because we don't think anything is wrong. But people will not, for the vast majority, will not know that anything is wrong with their kidneys without getting blood and urine tests until it's like time for dialysis. Because really the symptoms sneak up on a person really slowly towards the later stages, and then not until the later stages. But yes, diabetes and high blood pressure account for 2/3 of the chronic kidney disease that we see in the U.S. And this is in part, you know, someone brought up the filters, and I'm glad they brought that up. I sometimes try to simplify things when I'm not sure if folks are ready for the next level, but what the kidneys are doing, they make urine by filtering our blood. So when people talk about flushing out the kidneys and that kind of thing, I'm like, well, that's what the kidneys do. You can't flush something that's already flushing. But the kidneys are made of, each one has 1,000,000 little filters. The technical name is called glomerulus for one, glomeruli for all of them, but each one normally has about a million of these. And I liken them to like a colander when you're like cleaning our veggies. So, you know, the holes are big enough for dirt and water to pass through, but not the vegetables or whatever you're washing, right? And the kidneys are similar. The holes are big enough so that, you know, like the waste and all the extra water, all the extra electrolytes, all that stuff can pass through, but too small for protein to pass through. And different diseases like high blood pressure and particularly diabetes, they can cause damage to those filters so that more protein can get through there. And the more protein that gets out, the more damage it can do. So it's like protein is a sign of damage and can also cause damage. For high blood pressure, we don't see that much protein in the urine with high blood pressure, but it's more about the effect on the blood vessels. So in addition to being chock full of filters or glomeruli, the kidneys are also, I mean, it's just this massive web of blood vessels of various different sizes. I mean, it's truly amazing. So, I mean, I know I'm a little partial, but so high blood pressure can cause damage to all these little blood vessels. And if the kidneys don't have the filters intact and these blood vessels intact, they can't do their jobs normally.